Assalamualaikum doctors. In this video I am discussing about Duchenne muscular dystrophy DMD treatment. So how can we manage that? First I am telling why do you think it is DMD in the absence of family history of DMD. Remember, 2/3 of the cases inherited from the maternal side, X-linked recessive, and 1/3 of the new cases of mutation negative family history. So 2/3 it is an X-linked recessive conditions. Remember, DMD is an X-linked recessive condition, 2/3 cases. How do you manage the team? First of all, I will examine the CNS and MSK, looking for proximal muscle weakness, disturbance between the upper and lower limb motor neuron functions, positive Gower signs, chest signs of recurrent chest infections, dilated cardiomyopathy or regular heartbeat arrhythmias. Take growth parameters, may have short stature. So CNS MSK examination we do, Gower sign we do, positive and chest examination we do because they have recurrent chest infection. Also CVS examinations, they have dilated cardiomyopathy and regular heartbeats arrhythmia. Involve my senior and consultant if needed. Investigation diagnostic test is dystrophy gene study on short arm chromosome, X chromosome. If not positive, muscle biopsy, 95% sensitivity of the gene test. So genetic testing dystrophic muscles, there is what happened, dystrophy gene study. And also 95% muscle biopsy. Then lab we are doing CPK, usually high creatine phosphokinase. We do the radiology, chest X-ray, suspecting respiratory recurrent infections. EKG, that is suspected arrhythmia. Echo, looking for dilated cardiomyopathy. ECG and echo. Pulmonary function test, monitoring the respiratory failure with progression of DMD is a major cause of death. They may need respiratory support later on their life. So we are doing the dystrophic genetic testing, muscle biopsy. We do the CPK, it is high, ECG, echo, chest X-ray, and also the pulmonary function test. Medications or steroid may slow down the disease progression for 6 months up to 2 years. So steroid causes disease progression slow down. Atalurin or Translarna. Atalurin or Translarna, it is an antisense gene therapy given for patient who is more than or equal to 2 years old and can walk and his DMD is from nonsense mutation. So steroid and atalurin is the treatment. Advice wearing bracelet, especially induction phase, that is of anesthesia. Wearing bracelet, very good. Avoid some strenuous exercise. So wearing bracelet, avoid some strenuous exercise. Multidisciplinary team, I will involve the neurologist, physiotherapist, occupational cardiologist, dilated cardiomyopathy and arrhythmias, pulmonologist, risk of lung failure, geneticist, gene study and counseling, psychologist to address the emotional and psychological challenge associated with DMD, social worker to help navigate financial challenges, orthopedic surgeons, they may develop contractures, Achilles and hemiparesis. So these are the multidisciplinary team I will involve: neurology, physiotherapy, occupational cardiology, pulmonology, geneticist, psychologist, social worker, orthopedic surgeon. Genetic counseling, what we do? For the next baby, do genetic study of the mother. If she is positive, then the risk is 50% for the next baby. If she is negative, risk will be 1 to 3% for the next baby. Prognosis usually at 4 years difficult to stand from the floor, 12 years difficult to stand and walk wheelchair. Life expectancy with good medical care 30 years. Mortality, respiratory failure and heart failure. So 30 year adult life they can be with good care. Thank you.